Hey everyone, this is Dr. Zachary with your Performance Sport and Spine, and today I'm going to go over my 8 favorite stretches for low back stiffness and pain. So the Quadruped Rockback. So on your hands and knees, you're going to use your hands and press back, and you're going to want to relax your spine and then press back to get a good spot and then hold. Now some people may find that if they bring their knees out a little bit farther, it's a better stretch, but you'll have to kind of tinker with that to find that knee placement. But again, you want to push back to tolerance and then just hold, and we'll give you some general criteria and dosage, but you probably should tailor it to yourself. But again, the goal is to feel a mild stretch on the low back, not push really hard or feel no stretch at all. The tail wag. On your hands and knees, we're going to wag our hips like a dog side to side. So you're going to press your pelvis to the side as far as you can to the right, and then as far as you can as you're to the left. You want to make sure that it's your hips moving and you're not just bending your shoulders back and forth. And you want to really focus typically on that lower lumbar spine or those lower joints. So again, wag or push your hips to the right to tolerance, and then wag or push your hips to the left. And a good rule of thumb is if each time you can go a little farther and the pain or stiffness is less, that's a good sign. If for some reason your stiffness gets increased or the pain increases, that's probably a good sign to slow down or stop for that day. And again, gentle movement more than prolonged stretching or high intensity. Tall kneeling psoas stretch. So in a kneeling position, place one leg up where your foot's on the ground. So we're going to stretch this side. In an upright position, we're going to squeeze our glute forward until we feel nice tension on the anterior, the front of the hip. When you squeeze forward, don't crank too hard, and when you do it, you don't want to just overextend your back because that's not really the point. So again, trying to think about keeping that hip in line with your shoulders. Press forward with that buttocks, and then hold the tolerance. And again, you want to feel tension here, not so much in the low back. And then you repeat on the opposite leg. So with the right leg down in this instance, we're going to press our hips forward and feel tension over our anterior front of our right hip. Cat-cow. With our hands and knees on the floor, we're going to round our low back and mid back up towards the ceiling, bringing our chin towards our sternum. And in this position, we're going to hold it, take a deep breath in, and then a big exhale. As you exhale, we're going to arch our back down towards the floor, simultaneously lifting our head up towards the ceiling. And then repeat. As we bring our back up, we want to spend extra attention on our low back, and it may help to squeeze the glutes. In that position, take a deep breath in, and then exhale as we arch or extend our low back, lifting our head up. Each time you do this, you want to try to get a little farther than the previous time, but again, start slow and increase gradually over time. Knees to chest. Laying on your back with your knees bent, we're going to pull our knees towards our chest to tolerance and hold. Now some people might find this aggravating or too intense, so the two options is to pull less hard or just do one leg at a time, and then as the back relaxes and the symptom decrease, you can progress to 2 legs. But again, you want to pull with your arms and let your back relax and kind of collapse to the floor. And again, the goal is to pull just hard enough to feel a good stretch, but not so hard that it hurts or increases the guarding. So piriformis stretch. So crossing one leg over the other, taking your hands, place them behind the hamstring, let your head relax to the floor, and then pull up towards your head. And you should feel some gentle dull tension on the outside of that crossed over hip. Hold for a little while, remember to breathe, and then repeat on the opposite side. Now there's a good chance one hip is going to be tighter than the other, so it's best to pull independent and treat the one that's more stiff a little bit slower, and then increase over time. And again, remember to breathe and pull just till you feel a mild tension, not a severe tension. Supine rotation. So laying on your back with your arms stretched and both legs straight, we're going to take one leg and cross it over our body to the other side. Now there's no exact place your foot should be. So for me, this feels like good tension, this is too easy, and this hurts too much. So again, I'm just going to hold it right here because it's mild, but it feels pretty good. Continue to breathe and hold the tolerance. And then return to the starting position with the arms stretched out. We're going to repeat on the opposite side. Now, as you can see, this side's tighter, so I'm not going to try to force it to be the same as my right. And my left's going to be a little different, and that's fine. So I'm going to hold it here, and then maybe the next time or the second set, I'll try to increase the range of motion. But there's no exact way to do this, and adjust it to your current symptoms. The prone press up, laying face down on the floor, we're going to press up with our hands Or for me, I tolerate better onto my forearms. We're going to lift and extend our back as far as we can. Take a deep breath in and exhale, and really try to let our back relax down to the mat or the floor as best as you can. After you do that, we're going to reset. And again, I'm going to do it on my forearms because I tolerate that better. Press up as far as I can. Feel some gentle tension. Take a deep breath in, and then relax and let the back relax into the floor as I exhale out. Now again, if this starts to irritate your back, it may be best to avoid or just press up less far, do a partial range of motion, and then again, inhale, exhale, and let everything relax or collapse into the floor. Thank you for watching our video on back stretches. We really hope you found it helpful. If you did, please like our video and subscribe to our channel, and don't forget to check out our other videos.